Hi, my name is Kristen Barrett, and I'm a Pilates instructor in New York City. I first heard about functional manual therapy back in 2017 when I was going through my Pilates equipment certification. At that time, I was teaching fitness and Pilates mat classes at a gym and had recently recovered from a debilitating low back injury. I was no longer in the acute phase of my injury, but because of my active lifestyle, every 2 to 4 months I would suddenly experience a severe pain relapse. I had one of these relapses while I was in the midst of my certification, and luckily there is a team of manual therapists working out of the studio, so I made an appointment. I was in a lot of pain and really emotional when I started functional manual therapy. I had been told by my doctor that after 1.5 years of chronic pain, my back injury was finally healed and that I should be able to resume my life as normal, but my back kept going out. This was devastating for me because as a fitness professional, I needed a healthy body to do my job. I was so sick and tired of being in pain and was frustrated by my flare-ups and just wanted to be able to teach and work out without worrying if I was going to hurt my back. After just a few manual therapy sessions, my therapist was able to find and treat the cause of my recurring pain. They said the reason I was likely having these relapses was because of SI joint dysfunction and pelvis and lumbar spine hypermobility. Through their hands-on treatments and simple self-release and neuromuscular re-education exercises, I learned what types of movement triggered my back, how to ease my back out of a flare-up, and most importantly, started shifting my personal movement practice to focus on stability and strength. As I continued working with my manual therapist, I needed treatments less frequently and went from having a painful relapse every few months to just having a few minor musculoskeletal issues a couple times a year. Functional manual therapy is so different and honestly so much better than any other physical therapy treatment I have received. In the past, every time I went to physical therapy, I would warm up on a bike, maybe get 20 minutes of hands-on release work from my PT, and then would be handed off to a PT8 to spend the rest of the session doing exercises. This model was never successful for me. I've been a dancer my whole life, and every time I was injured, I was already doing private Pilates sessions, so I didn't need someone to just give me more exercises. What I needed was expert level body work to help undo years of inefficient biomechanics, poor posture, and muscular compensations. Functional manual therapists can do all of that. They are literally bodywork magicians. They work one-on-one with you for an entire hour, performing a combination of chiropractic adjustments, joint mobilization, soft tissue release, visceral mobilizations, and more. Because of manual therapy, I'm no longer afraid of getting hurt doing rigorous high-intensity exercises, and I feel confident in my body's strength, resiliency, and ability to heal. Shortly after my first appointment, I began teaching at a studio that offers both Pilates and functional manual therapy, so it has been a part of my life ever since. I still receive manual therapy treatments, mainly as monthly maintenance, and I recommend manual therapy to almost all of my clients. Movement itself is so powerful and can be so transformative, but what I've found is that when people are in significant pain, they need the help of hands-on treatment to get their bodies to a place where they are able to do corrective exercise and actually benefit from it. I currently share many of my clients with manual therapists, which makes for a really unique co-treatment experience The manual therapist will do important bony adjustments and muscular releases in their session, and then we'll get together and talk about what types of movement or exercises the client would benefit from, and then I get to facilitate that and help the client improve their movement efficiency and re-educate their joint mechanics and retrain their muscular recruitment. I definitely think that Pilates and really any form of corrective exercise is so much more effective with the help of manual therapy. If you are in pain and that pain is impacting your daily life and preventing you from doing the things you love, you have to try functional manual therapy. It really is a one-of-a-kind treatment that is performed by brilliant therapists, and I truly believe and know that it can change your body and change your life.